Good afternoon. This is Paul Vizard with Business Network Television on 38 TV. We're broadcasting today from Studio A at Distillery 98 in Serona Road, Santa Rosa Beach, Florida. If you haven't seen the show before, we talk to businesses and business owners and connecting businesses to businesses and businesses to consumers where necessary. And today I'm excited to have Sandia Hampton with HNC Homecare. Now, I know absolutely nothing about home care because maybe haven't gone through that process yet. So tell us all about it, what you guys do.
Okay, NHC stands for National Healthcare Corporation. And so NHC Home Care is an affiliate of
Hmm.
National Healthcare Corporation. And what we do exactly is we take care of patients at home after they've been in the hospital, after they've had surgery, an illness. We take care of COVID patients right now. So our goal is to get them back to be independent again. So we
Hmm.
get them back to their highest level of functioning and then we leave.
Okay, so would rehab be a right word for it? Is
Mhm.
there services involved in that to where if was somebody was convalescing from say an injury, is that part of what you
Yes,
do as
it
well?
is. Yes, it is. Physical
Hmm.
therapy, occupational therapy, speech therapy, and of course, skill nursing.
Right. So now that is strictly at home, so you don't have a facility where people go.
This is correct. People, we have found through research, people do really well at home. And
Mhm.
so this is a home service.
Gotcha. Now, what's the biggest area or the largest area that you cover in this area right here?
Well, the Panama City office covers Bay County, but we're kind of unique because we don't want to stretch our staff. And so we have offices that surround Bay County, like Chipley, for example. We have an office in Chipley.
Okay.
We have one in Carabel, Port St. Joe. We won't go any further, but we have at least those offices so that we can take care of patients in those counties. It doesn't stretch
Mhm.
our staff from driving too far.
Gotcha. So is everybody that works for the company, are they independent of that, or is it something that they're employees of the company?
Some are and some aren't. I'm an
Hmm.
employee, but most of our clinical staff are what we call contract
Hmm.
employees.
And how does that work? So they're just basically like they need skills like an RN perhaps, or
That is correct. So,
hmm.
like our nurses, they're registered, they're RNs, they're LPNs, and then we've also got our therapy team. We have physical therapists, occupational therapists, speech therapists. They all have their appropriate licenses, certifications. Yes, absolutely.
So what is the process when someone contacts you and say, I need something? How does that, do you have a consultation to see what they need and maybe visit the home to see what's going on there too?
Absolutely. So anyone can call us. We have to have a doctor's order in order to actually go in and provide services. But
Hmm.
anyone can call us and they do, asking questions. We can
Right.
even help them facilitate the doctor's order. So that's the first step. Then we get the doctor's order, then we call, we make an appointment, and we go in the very next day if that's convenient with the patient and their family, and we get started.
That sounds that sounds really cool. I mean, it's like to have that confidence that you can come home and certainly convalesce, as you say.
Hmm.
I'd feel a lot better at home than I would be in a facility somewhere. So I think that's really cool. Great service that you're offering. So how does it work with the doctors and so on? Is that something like it's generally a referral type situation?
It is. We get a large amount of our referrals directly from the hospitals, but you can imagine why, because there's more
Mm.
patients over there that need our services. And then we also get physician offices that will send a referral on an office patient. You know, you may have a patient that's got diabetes,
Mm.
CHF, COPD, and it's flared up, or they
Hmm.
feel like it could flare up. They could go into the hospital, so they want to
Hmm.
get them to us before this happens.
Right. No, it sounds to me like it'd be pretty important for somebody to be kind of on site as a little bit. So if there's something that is going on there that might need some attention, sounds to me like you've got somebody that's kind of on there. Now, is it a daily visit thing or is it weekly or do you
No,
schedule it?
no, what we do, Medicare, we go by guidelines for
Hmm.
Medicare and they're very strict. And so we follow it to the T. So they have an assessment that our clinician, our RN does the assessment for skilled nursing, and then the PT does it for physical therapy.
Hmm.
Therapy. So she goes in, she does the assessment, and it's very pinpointed. Once the answers are put in, from the individual, then it does its magic and it tells us how often we need to go in.
Gotcha.
So we could go in, a nurse could go in 1 to 3 times a week. The visits are always 1 hour. And then many times, if the patient needs skilled nursing, they also need some strengthening, some balancing, range of motion. So then our physical therapist would go in also and do a an assessment. So they would also go in 1 to 3 times a week. We try usually not to have it at the same time because we don't want to wear the patient out.
Gotcha. Yeah, I see what you mean there for sure. So you touched on Medicare. Is that as how everything is funded for this?
Medicare, the thing about Medicare, and let me stress traditional Medicare because there are so many plans now that have the word Medicare in it. But when I'm talking about Medicare, I'm talking about traditional, original, red, white, and blue card. The nice thing about traditional Medicare is they will pay 100% of the patient's cost once the deductible, the annual deductible has been met. And you can't necessarily say that for other plans. You know, they may pay almost 100% or they may not, but traditional Medicare does 100%. So our population is usually going to be those 65 and over.
Well, that's why you see so many commercials for Medicare supplement plans, isn't that right? So you got to fill in those gaps where you need to, right? So, you know, I think that this is something that's not necessarily as well known here, Ed. So I'm really pleased to have you on the show and have us talk about this a little bit. And so, do you have any thoughts about expansion into different areas of the counties here?
Well, we are hoping and praying that we will be moving closer west,
Oh, closer west, yeah.
closer to the Alabama lines from
Right.
where we are in Bay County. So we're
Gotcha.
hoping that will occur.
Now, do you come into Walton County at all? At this?
We're not
Okay,
licensed yet.
gotcha.
Yes.
And I hate to ask this question, but is there a facility here that somebody is picking up that
Oh
slack?
yes.
Okay,
Oh
good.
yes.
We
And
just want to make sure
we're
somebody's
very
here.
friendly. We're very
Yeah.
friendly. There are times when I'll get calls from hospitals over in Walton, and they will, you know, we can't take the patient because they live over here, and we're very friendly. I don't mind saying, you know, so and so is a home health agency over there, and you might want to give them a call. So, you know, you want to be neighborly.
Oh, absolutely. So you touched on this earlier as well. It's like how has the COVID affected sort of how things have been going? So is it obviously something you needed to be aware of and act
Absolutely.
accordingly? So tell us a
Absolutely.
little bit what you're implementing there.
Well, when it first started, I think everybody was in shock. And so we had to kind of regroup, and patients, we did have patients who wanted to cancel their services, but not as many as you would think. So then things kind of got normal, and then all of a sudden we had this second wave come in recently. And so things are tightening up. We had a patient recently who said, you know, she just wasn't comfortable having us come in. Well, the very next week, we got a flyer, an update flyer on COVID to remind primarily our referral sources, but we can also remind our patients that these are the things we're doing. We're following all the CDC guidelines, policies, procedures. We're following NHC's, National Healthcare Corporation, and theirs is just as strict, if not more strict.
Yeah.
And so we're doing all the right things. And so this should give people comfort. But you know, it's odd that you should ask, because I have to brag just a moment. It's odd you should
Brag all you
ask.
want. We're on the air.
I want to brag for just a moment because with COVID, we have actually seen an increase in admissions overall, you know, if you look at a year ago. And so we're really proud. CMS, which is the Center for Medicare Services, Center for Medicare and Medicaid, but Center for Medicare Services, they actually do a report card once a year, if you will. And it's a 12-month reporting, you know, the last 12 months of reporting. They're
Right.
always behind about 12 months. So that's why I say 12-month
Sure.
reporting. But anyway, long story short, we are now a 5-star agency on a 5-star scale. So we
So there
are
you go.
super, super pleased.
Yeah.
And
It just shows you're doing everything right.
yes, I mean, we could not be happier. And I know this may not mean anything to you, Paul, but our 60-day rehospitalization rate is at 9.5%, and the national average is 14 to 15.
Oh, so there you go.
Yeah.
Now, are you doing anything with vaccinations at all over there no, not yet.
No,
You're not
no,
getting any?
we don't. Oh, you mean
Would
like the
you?
COVID?
Yeah, yeah.
Oh, I'm sorry. When you said vaccination, my mind went to flu and pneumonia.
Yeah, chicken
No,
pox.
no, chicken pox. Yes, we are not giving the vaccine, but we are encouraging our patients, certainly, and family
Yeah,
members. We're educating.
sure. But you
Absolutely.
could, if you were given those, is that something you could do?
Yes, we
Yeah.
could. We most certainly could.
Obviously based on doctors and whatever, the governor says today.
Absolutely.
Whatever.
Absolutely.
I mean, it makes total sense to me. You're talking to me about home care, and it's like you're going visiting there, and you've got nurses. I'm like, I don't know, put the two together, and there you've got a solution. So what am I? What do I know? Hey, governor, if you're watching, so we'll send that to him. So, Sandia, it's
Yes.
been a pleasure talking to you. Is there
you.
contact information that we can put out there for the folks that might be watching here and might want to take you up on your offer of your facilities?
Absolutely. Carolyn, help me out just a
Oh,
moment.
there you
And
go. It's on the screen. Look.
is the Carol perfectly? What is? Help me.
It's 850-769-5256.
Okay, thank you. It's like your home phone number. You don't know it, and so you
Right.
never call
Well,
it.
let's tell you what. Well, maybe John can get that phone number from you there, and then we're gonna read out the email address at the
Okay.
bottom here.
Okay.
Yeah. So there's Carolyn's email. She's off camera here. That's why we're trying to have a conversation with the air. So there's Carolyn's. So what is that? It's I can't see because
Heitman at NHC.
there you go. NHC care.
Uh-huh.
Right. Okay. So there's two C's in there. That's where I was. That's where I was thrown off there. I wanted to make sure that people could see that they could read it. I'm sure, but that's good. So we'll start with the email address, and maybe you got a phone number as well. Did you get that in? Oh, look at you.
Look.
So there you go, 850-769-5256. And this is great. Now,
Yeah.
there's a website as well, obviously, that's HNC Care, right?
My home I should know this. My home care. My NHCHomecare.com. I
Okay,
knew
well,
I'd get it out in a minute.
there you go.
My NHCHomecare.com.
Awesome. All right, well, we'll put that on the screen. Look, there you go. Look at that.
Look
in
look
front of
at
our
you. Wow, magic.
See, this is the professional show that we have here. I don't know if you noticed. So we're glad to have you on, and maybe we'll have you do a follow-up with us at
We'd
some
love
point
to.
and see. Thanks so much.
Thank you,
Pleasure to
Paul.
meet you. It was fun.
Thank you.
And we're going to see you next time on Business Network Television. And be sure to share this with your friends. And I'll tell you what, you can subscribe to all our channels on Roku, Amazon, all the streaming TV devices that you can get your hands on. And for more videos like this, you can also go to 30a.tv. And guess what? You can watch us live 24/7 at 30alive.com.